I have a primary immunodeficiency. This means that I am very prone to getting coughs, colds, and winter viruses. Once I get ill, it lasts for twice or 3 times as long as for other people. And I also get very tired and have to make sure I get enough sleep in order to cope with my daily routine. I was diagnosed when I was 7. Before this, I was very rarely well. I had constant chest infections, coughed most nights, and was always exhausted. Because of this, my development, such as walking and talking, and then my progress at school, was delayed. I was referred to several different hospitals and had several different diagnoses, but nothing helped. One day, when I was 7, we were at an appointment at the Brompton Hospital in London, where I was being treated for supposed asthma. And my mum asked the registrar, "As Rachel keeps catching things, is it possible to check out her immune system?" My mum had never heard of primary immunodeficiency and didn't really know what she was asking for. But we did get a sub-referral to Professor Adrian Thrasher at Great Ormond Street. And very quickly, by taking a few blood tests, they gave us the answer. I have low IgA and IgG2 subclass deficiency and specific antibody deficiency. I started on monthly intravenous infusions of immunoglobulin, and almost immediately, my parents saw a difference in my energy levels and ability to cope. I started to catch up with my peers physically, socially, and academically. Great Ormond Street is a truly special and wonderful place. The staff took really good care of both me and my parents. The nurses would play games with me and keep me entertained whilst I was doing my treatment. I felt so well looked after, and the wards I were on were all really lovely. When I was 10, I was asked to take part in a trial of new treatment, delivering the immunoglobulin subcutaneously. This was much easier and quicker, as it meant I could infuse at home once a week and no longer had to visit a hospital. One of the clinical nurses came down from London to Sussex to show my parents how to prepare the treatment and give it to me. She gave up a whole day to do this, which is amazing for just one patient. This is the level of care that was normal at Great Ormond Street. When my mum gave a talk in 2009 on the 4th plinth in Trafalgar Square about primary immunodeficiencies, Professor Adrian Thrasher came along to support her, which was an amazing thing for him to do. I feel this shows how caring the staff at Great Ormond Street are about their patients. You can imagine, after receiving this level of care and support, it seemed quite daunting when I realised that Great Ormond Street would not be my hospital forever, and at 16, I had to leave and go somewhere else. The hospital I moved to was the Royal Free in London. Before moving, we had a transition meeting where my consultant, Professor Adrian Thrasher, and one of the clinical nurses were present from Great Ormond Street, and consultant, Professor Bodo Grumbacher, research sister Sari Workman, and clinical nurse Andrew Symes were present from the Royal Free. So that's a picture of me with Bodo and Adrian giving a talk at a different conference. The fact that the consultants and the nurses were both present and that they had taken the time to meet each other and me and my mum to discuss my case was incredibly reassuring. It meant that I wouldn't be anonymous at the Royal Free. The team would know me and I them. This gave me the confidence that I would have the support in place and the ability to get in touch if need be. I therefore did not see leaving Great Ormond Street as a frightening prospect and was not worried about what would happen about my care in the future. This made such a difference, not only when I moved, but continued afterwards, to make me feel like I could rely on the team at the Royal Free if I needed any help or advice. It made my first appointment at the hospital so much less intimidating, as seeing familiar faces and knowing names, and them greeting me and my mum by name, made a lot of difference. I think the positive benefits of having the transition meeting still impact on me now, 7 years later, as it meant I built a rapport with the staff and from then on always felt supported and recognised as an individual. Whilst the Royal Free is a different environment from Great Ormond Street, it is not quite so nurturing. I feel that at 16, I was ready for this change and to move into adult care. I see the immunology team at the Royal Free every 6 months to a year, and I'm able to contact them whenever needed. Having this level of care and them knowing me as an individual has been really important. For example, 2 years ago, I was unwell in hospital with suspected encephalitis. Being able to get in contact with a team that knew me made a huge difference to how supported I felt during this time. To conclude, I feel having a transition meeting and adult care in place makes a huge difference to how supported and reassured patients feel about their transition between services, as this can be a very daunting prospect and worrying time. Having a meeting can also have lasting effects for patients, as they are able to build a rapport with the new care team and feel recognised as an individual within that service. Thank you for inviting me to speak here today.